I'm joined here with Heath. Claire is a postdoctoral research fellow in Dr. Desiree LaBeaud's lab at Stanford University, and she just was awarded the Robert E. Shope International Fellowship in Infectious Diseases here at ASTMH. Congratulations, Claire. That's really exciting. So I wanted to talk a little bit more about some of the research that you're going to be doing. I understand you're going straight from here to Grenada to study chikungunya virus. So could you talk a little bit about chikungunya virus? What are some of the findings that you presented actually here at the meeting on the prevalence and why Grenada?
So Grenada was affected pretty badly last year with an outbreak of chikungunya virus, which is an arthropod, mosquito-borne virus, and it affected like thousands of people over there, and actually up to 90% of the population of that island have seroconverted since to have anti-chikungunya antibodies.
90%?
Have seroconverted, yes.
Wow.
And we had samples from back then during the outbreak. My project now, as part of the Shope Fellowship, is to go back out there, follow up with these people, see how they're doing like a year later, take repeat blood samples from them. But really, one of the distinguishing marks of this virus is that it can cause chronic arthritis. So that's what differentiates it from other arboviruses like dengue fever, for example, is that it can cause like really long-term arthritis, and people suffer for a long time afterwards. So my project is that I'm going to look at people who are still suffering like a year later, suffering with chronic arthritis, compared to those people who've recovered and got over it, no problems, and do immune profiling on them to see if their immune systems reacted differently, and that's why they're still having these symptoms.
Great. And it sounds like there's really not all that much that's really known about these viruses and the long-term health impacts. Can you talk a little bit about why that is, and why we need a lot more research in this space?
Well, historically, as I've said, chikungunya presents very similarly to other viruses that have been transmitted by mosquitoes, and so I think a lot of data is missing because in areas where the virus is endemic or even epidemic, a lot of the times it's sort of, say in Africa, people assume that it's malaria or even dengue virus, and of course these places don't tend to have diagnostic resources that we do, which has like hindered the understanding of even the epidemiology, let alone the molecular side of this virus. And so in relative terms it's still quite a novel virus, and not a lot is known about it at all, which I hope to change with this fellowship.
And how long will you be there in Grenada?
For about 6 weeks to start with, but with the funding that I've got at the moment, but I'm really keen to get this pilot data, and hopefully we can expand the study for long term and really help people out.
Copyright Stanford University, all rights reserved.